Hi guys, welcome back to my channel. Today we are going to talk about a very highly talked about topic, and that is food allergies. I myself do not have any food allergies, thank goodness. My son doesn't and my husband does not, so we're pretty lucky around here, but a lot of people do, and I kind of wanted to talk about it. There is so much that can be talked about within this topic. So we are just going to barely skim the surface of food allergies today, and I probably will make more in-depth videos later on. Adverse food reactions can be broken down into either food allergy, which is immune-mediated, or food intolerance, which is non-immune. Food allergy is broken down into three parts: IgE-mediated, non-IgE mediated, and mixed non-IgE mediated. It's going to start getting confusing, and this is what I mean when I talk about how it is very in-depth and there's a lot to talk about. Non-IgE mediated is broken down into FPIES and FPIAP, and mixed/non-IgE mediated is eosinophilic esophagitis. I cannot say those words, I had to look. Food intolerance, on the other hand, could be, for example, lactose intolerance. Okay, so we're going to start with non-IgE mediated allergy, FPIAP. This stands for food protein-induced allergic protocolitis. I think I said that one right. This one can be usually determined or diagnosed in infancy with finding blood in the stool. Some common offending foods could be cow's milk and less often soy. Some dietary interventions, since it's in infancy, if a mother is breastfeeding, then they just avoid the offending foods, so they avoid the cow's milk. If they're formula feeding, we're going to want to make sure that the formula is hydrolyzed or amino acid based, so that it doesn't have that cow's milk that can cause all of those adverse reactions, which we don't want. It can resolve late in the infancy, which is great, so that you can start introducing that cow's milk after about 2 weeks of keeping it out of their diet. Next one is FPIES. This stands for Food Protein-Induced Enterocolitis Syndrome. Again, I am so bad with pronouncing any complicated terms. So, this causes a delayed reaction 2 to 4 hours after eating a specific food, which can cause like vomiting or like hypovolemic shock, which is kind of scary. Could be like misdiagnosed and confused with like GI issues. Some of the offending foods are cow's milk, soy, grains like rice, barley, oats. But again, this one can be outgrown by the age of like 4. So again, hopefully they can outgrow these, just because this is no way to live by cutting out so many offending foods. So something to keep in mind is that these conditions may increase the risk for IgE-mediated allergies, so that's why I keep saying like we want to reintroduce after the 2 weeks or like once they turn 4, just because if you keep reintroducing it, less likely to get the IgE-mediated allergy. So next is mixed cell mediated allergy, so EOE. I'm going to try and pronounce this one. Eosinophilic esophagitis. I still don't know if I said that right, but common symptoms can include difficulty swallowing, persistent cough, reflux, which again you do not want with your infant, especially when you're trying to feed them and then they keep spitting everything up and not being able to consume those nutrients. You can see this upper endoscopy reveals the stricture or the rings inside the esophagus. That can tell you if you have this. Treatment for this is the dietary restriction, so the elimination diet, so that's 2 to 6 food elimination. You take out a couple food items for a few weeks, see how your body does, and then you can slowly start incorporating it back and then see how your body does with that. Again, I've seen this with a couple of the participants, and it is no fun for the parents, for the baby, no fun at all. IgE-mediated allergy, rapid onset, usually within minutes, which is good because you want to know if something's happening to you after you eat something. It could be up to 2 hours after consuming that. Food protein, with the most common being like the top 9, so cow's milk, eggs, peanuts, tree nuts, fish, shellfish, wheat, soy, and sesame. Those could all be the foods that can cause IgE-mediated allergy. These can cause life-threatening reactions like anaphylaxis, which is pretty scary. Signs and symptoms of the IgE-mediated allergy could include exposure to the offending food, like the mouth, throat, brain, eyes, etc. That could see signs of anaphylaxis. Also, like itching, tingling, shortness of breath, abdominal pain, hives, runny nose. There are so many complications that could cause or could be caused by these offending foods. Ways to diagnose if you have IgE-mediated allergy could be a detailed history of what you've consumed, like looking back at all of the food that you ate throughout the day and seeing if they had like food items like the top 9 that we were just talking about. The second thing could be a serum IgE blood test, and then if that didn't show anything, third thing would be like the oral food challenge. So you consume things, see if you get a reaction that way. And again, I want to put an emphasis on that we want to keep reintroducing a food item so that we don't continue to be like allergic to these food items, as long as it's safe, as long as you've talked to your doctor. But in some cases you are able to reintroduce after a while, after your body's kind of gotten used to it, or like kind of relaxed, and then you can start slowly introducing some of these foods. A lot of people ask what causes a food allergy, and that is still unknown just because there's so it's multifactorial. So it could be so many reasons combined that you can't just pinpoint to be due to vitamin D hypothesis, hygiene hypothesis, dual allergen hypothesis. But there's so many factors that it's hard to pinpoint. So research hasn't figured out what causes it quite yet. There isn't a lot of research that shows that introduction of these allergy foods at a young age helps prevent the food allergies. There has been some research shown that if you are able, try and introduce a food allergen when possible for your young child so that their body is getting used to that allergen food and they are less likely to get this food allergy. So I know at my job I do try to get parents to start these food allergy introductions at a young age, just because we're seeing so many children with food allergies that I feel like if you're able to, I would provide the eggs, peanut butter, all of those foods at a young age, just because again there's so many kids who have that allergy, and some parents are just avoiding it altogether because they're scared their child's going to have it, which I get, it's scary, but the more introduction you have for those food items, the less likely. How do you go about this? Because it is pretty scary, especially with a baby. You don't want to hurt them by any means, but you want to make sure your baby's healthy. If they're not healthy, if they do have a reaction to a food item, it could hurt them even more than if it did with a healthy baby. So again, talk to your doctor, and then what you're going to do is you're going to start with a small amount, so eggs, just a little bit, have them eat it, and then wait about 10 minutes, and then you're going to continue feeding them, just see how they're doing, and then you would just wait and you watch them for 2 hours and make sure they're not having any allergic reaction. Like I said, it could be within minutes or it could be up to 2 hours for this onset. The risk of not introducing the allergens could significantly increase the risk for food allergies every month that introduction is delayed after 6 months of age. So keep that in mind when you are trying to feed your baby. Early infant feeding is key to help prevent these food allergies, but that's not the only thing. Other things that could cause or contribute to food allergies could be environmental, vitamin mineral deficiency, C-section deliveries, medications, microbiome. They all could be contributors to play a role in potentially having a food allergy. With all of the research that's out there about food allergies, we can take away that nutrition intervention is currently the most effective and evidence-based approach to reducing the risk of these food allergies, that your child has a healthy diet, it's high in fiber, diverse for mom and baby, may also help reduce the risk. So the question, what if my baby does have a food reaction? The research shows that 6 to 8% of children have one or more food allergy, which really means that 92 to 94% of children do not, so that's a positive note. And then another question is, can food allergies develop after early childhood? And the answer is yes. More than 10% of adults have one or more of these IgE-mediated allergies, and many are developed in adulthood. So food allergies can develop anytime. So that's why I said at the beginning, I don't have any food allergies right now that I know of. That doesn't mean I won't develop one in the future. Hopefully not, because I have a healthy, well-balanced diet and I try new food items, new ingredients, so hopefully I'm helping myself with that, but who knows. Well, that is just a little tidbit that I wanted to talk about today. I mean, it wasn't really in-depth, but it kind of gave you an overview of like non-IgE mediated allergen foods and like IgE mediated food allergies. So do plan on diving deeper into maybe more specific areas, like how to prevent them, dietary interventions, stuff like that. But today I just kind of wanted to talk about a general overview of food allergies, and we will definitely be putting out more videos more in depth about this topic later on. Bye.